You recently delivered an inaugural lecture, the 592nd Inaugural Lecture of the University of Ibadan. And the title of your lecture is Our Children's Mental Health, Our Nation's Wealth. Can you connect this to the life that the children of Victor Banjo went through?
Yes. Mental health is a very positive term. Mental health is about optimal psychological development, optimal psychological functioning, being able to have meaningful relationships with people, being able to work, contributing to society, being a contributor to society, having resilience to withstand traumatic events, and resilience also to go through life. Mental health is an integral part of health. There's no health without mental health. And it's important that we see it as a positive thing. Mr. Abilo, you need mental health. We all need mental health. We need optimal psychological functioning.
Mental health is equal to mental illness?
No. On the other side of mental health, along a continuum, there's mental illness, mental disorders. When there's problems with the thinking, problems of when there are different kinds of illness, that's what we call psychosis, where you may have voices, where you hear voices that others can't hear. You see things others can't see. You have abnormal beliefs. Like I could say now, Mr. Bello, I'm not going on with this interview. All these cameras are witches. They are talking about me. Or behind this wall, there are people watching, and so on and so forth. So, abnormal. And then you could also have depression, which is so common. What is depression? When you have, you feel low mood, loss of interest, loss of energy. Interestingly, I looked at my daddy's letters and I found that there were times when he had depressive symptoms. That some days he would just say, I feel down. But the difference is that when you are depressed, you are fine, like for at least 2 weeks, you are down. You don't come up. Your mood is down. Loss of energy, loss of interest, hopelessness. Some people who are depressed even start to have suicidal ideas. They may even attempt suicide. They have aches and pains, poor concentration. Somebody will say, I used to be able to read. I don't feel like reading anymore. You feel fed up with life. You feel like hopeless, helpless. So then even in children, you have behavioral problems, stealing, lying, running away. There are different kinds of disorders. But mental health is a very positive thing. Mental health, we all need mental health. And the government needs to do things that will promote our mental health, starting from even in the womb. I enjoyed good mental health.
Okay.
I did. Because my mother was at peace when I was born. My mother was able to breastfeed me for 13 months. I went straight to cup and spoon. She was able to shower on us love and care. We were not tossed around. She was able to talk to me, stimulate me. So my brain cells were developing. She was able to speak to me and make me feel that I'm special. And of course, discipline and so on, and draw boundaries. And then of course, I was able to go to school. When I was sick or with physical sickness, I was well taken care of. I wasn't tossed around, left to roam the streets, out of school. And despite the problem of my father exiting our lives, our mother was able to provide us with good mental health. And that's why I have grown up to be an adult that can give back to my country. There's a link. If my childhood was different, scattered, I didn't have good education, I was traumatized, and there are all different kinds of trauma. There are some children who are in places where they are being physically abused. They just beat them anyhow. There are some children who are being sexually abused. An adult in the environment is, having sex with them or touching parts of the young children. Or psychological abuse, where you constantly hear, you are a fool, you are an idiot, you will not succeed, you will not do, you understand? All those things, that's psychology, all those things affect a child. Or emotional neglect. You just neglect the child. Child doesn't have their needs are not, there's inconsistent, you find it in places like children's homes, places like the institutional aspects of the juvenile justice. When a child doesn't have good mental health at that early stage, they are more prone to have mental illnesses and disorders, and they are more likely, because it affects their brain. the architecture. It even goes on to affect the ability to conceptualize and think. And sometimes you wonder about why we have not developed.
So if a child does not have a stable childhood,
yes,
happy childhood,
yes,
and then eventually grows into an adult and becomes successful,
yes,
or becomes a leader,
yes,
what kind of leader would that person be?
Well, you can't give what you don't have. You can't give what you don't have. And many times I wonder about some of our leaders. What kind of childhoods did they have? If a child has had a good childhood where they were secure and safe, they are more likely to have what we call security, confidence. They are more able to be able to plan, execute things, look globally at the situation. They are less likely to have behavioral problems. One of the commonest causes of antisocial behavior, where people steal, lie, destroy, is childhood trauma. Childhood trauma. Studies have shown the commonest cause of antisocial personality behavior in adulthood is a problematic childhood.
So can we link some of the poor behavior of leadership
It's possible.
to problematic childhood?
Yes. If you are not trained to conceptualize and plan and execute and think and bring things together, it will be difficult. If you've had a very those things affect functioning.